Hi, this is Trapti. I am the pelvic floor therapist, founder and CEO of Theragurus. I've been helping women since few years, and I have helped like thousands of women with their pelvic floor symptoms. And today I'm here to talk about the main reason of most of the pelvic floor issues we have. So let's talk about it. So think about your abdominal area as a pressure canister. And today I'm going to use this board to explain you a little bit more in detail so that you have a better understanding. So let's imagine that this intra-abdominal area is a pressure canister. So I'm going to draw that here. Right? So a pressure canister has four corners, right? Similarly, our body has four corners: the front, the back, the top and the bottom. Top, bottom, front and the back. Okay. So if you look at my body, and I'm going to draw another picture to explain that, the top lid is your diaphragm, which is a dome-shaped structure. This diaphragm sits directly under the lungs, under your ribs. So if these are your lungs, or you can say your rib cage, then your diaphragm is right under it. So this forms the topmost structure. Now when you go at the bottom, this structure in this shape is your pelvic floor muscles. So this is your diaphragm, and this is your pelvic floor muscles. Okay. Now the front of it are abdominal muscles. And the back of it are your back muscles, the muscles that support your spine, like multifidus and all those paraspinal muscles. I'm just taking multifidus as a reference. Okay, so this is how it looks like. Now imagine that this is a pressure canister with your diaphragm at the top, pelvic floor at the bottom, abdominals at the front, and back muscles at the back. Now this pressure canister has to have an optimal pressure. Like it has to be a managed pressure in order for all of them to function right. Make sense? Like if this is a pressure canister, if this is actually a can, the pressure has to be regulated inside it so that all the walls are stable, top walls, side walls. Similarly, the same thing happens in our body. Now imagine that this pressure gets disturbed. So again, think of a pressure canister. If this pressure is like too much of a pressure, let's say in this direction, it's going to hurt your diaphragm. If it's in this direction, it's going to hurt your pelvic floor muscles. If it's in this direction, it's going to hurt your abdominals. If it's in this direction, it's going to hurt your back muscles. So basically, long story short, if there is a pressure mismanagement in the pressure canister, it's going to impact your different areas. Now what happens is, most of us, when we breathe, we don't engage our diaphragm. So what happens? Like if you're not going to engage your diaphragm, the diaphragm is going to just stay stuck in that position, and that is going to disrupt the pressure inside. So I'll explain you quickly how that works. What happens is when these lungs are full with air, like when we inhale and we fill our lungs with full air, the diaphragm that's sitting right beneath my ribs and beneath my lungs flattens with the pressure. So when I'm taking inhale, this flattens. So basically this goes down with inhale. Okay. Now that pressure gets transmitted to the intra-abdominal area, and that pressure gets transmitted to the pelvic floor muscles, and in response to it, your pelvic floor muscles lengthen. Now you think about it, when this mechanism is happening, the pressure is still managed, because with the inhale, the pressure is transmitted to the intra-abdominal area, and then this gets transmitted to the pelvic floor area, and your pelvic floor muscles are lengthening in that case. Now again, like I said, coming back to that point, now imagine if your diaphragm is not moving, which is a muscle. Your diaphragm is a muscle. So if it's not moving, it becomes rigid, or if it becomes weak, that's going to disrupt the pressure in here, right? And with that disrupted pressure, that can cause unusual discomfort in your pelvic floor muscles, because again, if there is a lot of pressure here, one of your very important role of your pelvic floor muscles is to hold the organs in place. So they're going to have to work harder to hold the organs in place. So these become, start holding tension. They become weak as well. It can also impact your abdominals. Or let's say if your abdominals are weak, it's going to cause more impact on your back muscles, because then all the pressure is going to your back muscles. Your back muscles are the main supporters. So basically, long story short, if this pressure is disrupting, people end up having a lot of issues. People sometimes end up having like core weakness, like abdominal weakness, sometimes back pain, sometimes hip pain, sometimes leakage, incontinence in their pelvic floor area. A lot of women, they end up having prolapse because of that pressure mismanagement. So what happens is a lot of hip pain, back pain, like people go to therapy and they are working on all those muscles, but this one important and real important piece, which is your pelvic floor and your breathing coordination, is missing, and that's why they are never able to get rid of the back pain. It's like a lifelong thing for them. Similarly, a lot of women, for incontinence, they just do Kegels and they feel like, oh, I'm going to strengthen these muscles and it's going to work. But then what? If this pressure mismanagement is still going to be there, do you think it's going to work? No. So basically, we are treating the symptoms. We are just treating the back symptoms, the hip symptoms, the incontinence symptoms, but we are not working on the system that makes it all work. So my lesson to you guys is, hopefully this was helpful. Hopefully you were able to understand what I'm trying to convey here, that breathing is a very important component of your to keep your core integrated. And your core again is made of your abdominals, your back muscles, your pelvic floor muscles, and your diaphragm. So this is your breathing has a very important role in maintaining your core. And if that is disrupted, definitely you need help, you need attention to fix that, because just that one thing is going to lead to so many other issues like I just talked about. I hope this was clear to you, but if you guys have any other questions, you can just put the comment in the comment section and we will get back to you. Thank you and have a great day. Bye.